Good morning. This topic is near and dear to me. It has to deal with dementia, and in my world, I got to make sure my patients are not struggling with dementia simply because you can't treat them for major diseases if they do. So, the question that I've been asked is a simple blood draw, could it possibly diagnose Alzheimer's disease? And what if one day we could simply do that? It wouldn't require a spinal tap. It wouldn't require an expensive brain PET scan. Just a simple blood draw. That would be amazing. The future is beginning to arrive, and for millions of patients and families, including my own, worried about memory loss, this is genuinely encouraging. This is very exciting. For decades, diagnosis of Alzheimer's disease has been quite difficult. If someone begins forgetting appointments, repeating questions, getting lost, or having difficulty doing things, especially in the age of, we all have a cell phone, we don't memorize phone numbers, we don't remember addresses. So then the question becomes, do you have memory problems? And then is it simple stuff? You have thyroid disease, B12 deficiency, you're depressed, you don't sleep well, you've had a stroke, or even other neurological diseases. So, a blood test really does not replace careful medical evaluation whatsoever. Now, another powerful piece of information that could tell us something to give us an answer about Alzheimer's would be wonderful. So, what I want you to know is that Alzheimer's disease is associated with an abnormal protein that accumulates in our brain. Two of the most important ones are called amyloid beta, and the second one is tau, TAU, which I'm very familiar with. For years, detecting these changes usually required very specialized testing, such as amyloid PET scan or examination of the fluid that covers your brain called CSF or cerebrospinal fluid through a lumbar puncture, basically a sticky needle in your back. Now, researchers discovered that tiny signals from these abnormal brain proteins can also be detected in the blood. One of the most exciting biomarkers is basically uh, the medical term would be phosphorylated tau, TAU. And I'll put that in writing so you have it. You may hear other names, especially if you're battling Alzheimer's. P dash tau 217 or P dash tau 181. Don't worry about remembering these numbers, it'll be in the footnote. But the important point is this: these proteins can provide clues about whether a biological change associated with Alzheimer's disease is happening in your brain. And now we have an FDA cleared blood test. As of 2025, FDA cleared the first blood test specifically designed to help diagnose Alzheimer's disease. It measures the P tau 217 as well as beta amyloid 1 42, and it calculates the ratio. Why is this exciting? Because that blood test result can help predict whether Dr. Eason is likely to have amyloid plaques in his brain. And in a study reviewed by FDA, approximately 92% of the patients with a positive result had amyloid pathology, and this was confirmed by a PET scanning or spinal fluid testing. So, approximately 97% of people with negative results were negative on those confirmatory tests. And that's impressive. In my world, you jump up with joy. Now, there's something very important I want you to understand. This is not a general screening test. So the patients I'm going to see today who watch the video, uh, one of them is moments away from 8 o'clock, who's going to say, Doc, I'm 55 years old, I'm healthy, and I want to get the Alzheimer's test because I really don't remember where I put my keys. And I'm going to say, no, that's not currently how the FDA cleared the test. That's not the intended use. The first FDA cleared test was intended for adults that are 55 years or older who already have signs and symptoms of cognitive decline. And that doesn't mean I forgot my keys. And the result is interpreted together with the rest of the medical evaluation. It is not meant to diagnose Alzheimer's disease by itself. And a positive blood test does not mean you definitely have dementia. A biomarker, or a test that I normally order, tells us about the biology. But as physicians, we still need to do all the other stuff to make sure you're okay. Now, why could this be such a big deal? Because Alzheimer's disease is changing. And quite often, I've had patients look at me with sadness, say, Dr. Eason, why didn't we find this out early? What can we actually do? And the conversation is never fun, you know. And we now have treatments that can target amyloid in selected patients with early Alzheimer's disease. And even though those are not cures, they have the potential benefit and an important risks, and it's not appropriate for everyone. But their existence makes identifying the correct disease and identifying it early much more important. Imagine the future. Now I'm gonna get into my future mobile here. The patient notices subtle memory change. Instead of waiting for months, they go see their primary care doctor. The primary care doctor does a memory test. They realize, yes, you do have dementia. They ask you the appropriate questions. And then we order the test. And the test may lead us to catching this a whole lot earlier. But as always, please be careful. Blood biomarkers are powerful, they're not perfect. Many of them come back positive, but they're false. Many of them come back negative, but they're false. And sometimes we don't know what the heck we're talking about because they fall in the intermediate range. So, the research is still determining exactly how these tests should be used in people like my patient who's going to say, I'm 55 years old and I forgot my keys. And also, it's important to not randomly order Alzheimer blood test on everybody. The test needs context. The symptoms matter, your other medications matter, the neurological exam matters, and other medical conditions matter. Also, a PET imaging, the spinal fluid testing, an MRI, and neuropsychological testing, these are all important. So, what's the ultimate message? If someone you love or you care about or you know is developing memory issues, don't automatically assume they're just getting old, it's Alzheimer, get it evaluated, see the right doctor. And luckily now we're entering the era where we have tests that are going to help doctors make better decisions to care for you. If you happen to be my patient, please don't ask me about it. That's not something I'm going to order. And if you're not my patient, I hope you never need me. I wish you the best of luck, and I will put most of this in writing so you have something to go back to. And please share it with people you love and care about.